This video's aim is to help if you are suffering with Achilles tendonitis. The Achilles tendon connects the calf muscle in the lower leg to the heel bone of the foot. It is the largest tendon in the body and can withstand great force. Achilles tendonitis is most likely to develop due to overuse of the Achilles tendon, possibly due to prolonged running or walking, or someone with altered biomechanics of the foot, ankle or knee. The symptoms are usually pain at the back of the heel, made worse when walking or running, swelling or thickening and sometimes heat along the tendon. There is also sometimes some restricted movement of the ankle joint. It is usually tender to touch in this area. Achilles tendonitis can be diagnosed by your GP or physiotherapist from the presentation of your symptoms. Usually no further investigations are required. Rest the tendon from the aggravating activity, apply ice over the tendon, always wrap the ice in a towel to avoid an ice burn, take a course of anti-inflammatories unless you have been advised not to take these by your GP. Painkillers will help control pain until it subsides. Take advice from your pharmacist. The latest research states eccentric control exercises can help. This is where the muscle elongates whilst working. A physiotherapist can guide you through these exercises. This must be done gradually and not progressed until the exercise is pain-free. A physiotherapist can help to put a tailored exercise program together for you, but here are a few things that may help. Calf stretch for the gastrocnemius muscle. To stretch the right leg, take a long stride forward with your left leg, keep both of your feet pointing forwards, now while keeping your back knee straight and your back heel in contact with the floor. Start to bend your front knee and lean your body forward until you feel a stretch in your back leg's calf. Hold for 30 seconds and then repeat for the other leg if needed. Calf stretch for the soleus. Take a long stride forward with your left leg, keep both of your feet pointing forwards. Now while keeping your back heel in contact with the floor, start to bend both knees and lean your body forward until you feel a stretch in your back leg's calf. Hold for 30 seconds and then repeat for the other leg if needed. Remember, one of the other potential causes was foot posture. Here is some information to help you work out what your feet do and therefore what can help. When it comes to choosing what trainers to buy, it is important to know what foot type you have. This will determine what you need from your trainer. Most people overpronate, which needs support and motion control. If you are neutral, then you need a mix of slight support and cushioning. If you are the least common foot type, then you are an oversupinator. You will need lots of shock absorption and cushioning. As you can see, here is some video analysis of an overpronator. Note the tilted in angle of the heels. This is an oversupinator. As you can see, the heel tilts out. The final video is of a neutral foot type, which is the heel being close to perpendicular to the ground. You can get trainers and insoles specific to your foot type, and this may also help. Obviously, if you are unsure on this, then your physiotherapist can guide you on correct footwear and insoles. If you get worsening symptoms or are unsure, then initially reduce the push into discomfort, and if this isn't enough, then stop altogether and consult your physiotherapist. After several days, you should hopefully notice increased flexibility and possibly reduced pain generally. When things are improving, you can start the eccentric strengthening exercises. Eccentric calf exercise on the floor. Standing on the floor on your unaffected leg, simply raise up onto your toes. Next, place your affected foot down onto your toes and lower your heels to engage the calf muscles. At first, do the lowering with each leg taking equal weight. When you can advance pain-free, then start to do the lowering part with more and more weight on your affected leg until you are on the affected leg alone. The next advancement is to add resistance. Resistance is achieved by bearing weight across your back with a bar or holding a dumbbell in your hands. Repeat the exercise 10 times and do this every day. You should always be pain-free during this exercise and should start with body weight only. Once you can advance without pain, then add light resistance and build up slowly as long as there is no pain. The aim is to get up to a very substantial resistance level so that you are training the tendon to tolerate more load. Once you have done this, then you need to do an eccentric calf exercise on a step. Eccentric calf exercise on a step. Standing with your unaffected foot, with your heel hanging off the edge of a step, simply raise up onto your toes. Next, place your affected foot down onto your toes on the edge of the step and lower your heels to engage the calf muscles. At first, do the lowering with each leg taking equal weight. When you can advance pain-free, then start to do the lowering part with more and more weight on your affected leg until you are on the affected leg alone on the lowering part of the exercise. The next advancement is to add resistance. As you did previously, repeat 10 times and do this every day. You should always be pain-free during this exercise and should start with body weight only. Remember, injuries take time to recover and do so gradually, so be patient, there are no miracle cures. Physiotherapists are trained to treat Achilles tendonitis. They use evidence-based techniques such as deep tissue friction massage, ultrasound, acupuncture, and an exercise program which can help to settle the symptoms and aid the healing process.